NCLEX style quiz on pneumonia. 1. A patient with pneumonia is experiencing pleuritic chest pain, a high fever, and a productive cough. Which of the following interventions should the nurse implement first? A. Administer the prescribed antibiotic. B. Teach the patient deep breathing exercises. C. Encourage fluid intake. D. Monitor oxygen saturation levels. Answer: D. Monitor oxygen saturation levels. Rationale: monitoring oxygen saturation is essential as it helps assess respiratory function. Hypoxemia is a common complication in pneumonia. An immediate assessment of oxygen saturation will determine if supplemental oxygen is needed. Administering antibiotics is crucial, but should follow the prioritization of assessing the patient's immediate oxygenation needs. 2. In assessing a patient with pneumonia, the nurse notes dullness to percussion over the left lower lobe, decreased breath sounds, and increased tactile fremitus. Which of the following conditions are these findings most consistent with? A. Pneumothorax. B. Pleural effusion. C. Consolidation. D. Bronchitis. Answer: C. Consolidation. Rationale: dullness to percussion, decreased breath sounds, and increased tactile fremitus are classic findings associated with lung consolidation, which occurs when alveoli are filled with fluid and inflammatory cells, as in pneumonia. 3. A nurse is preparing to discharge a patient with community-acquired pneumonia. Which of the following statements made by the patient indicates the need for further teaching? I will complete the full course of antibiotics even if I feel better. B. I should avoid crowded places while recovering. C. I can stop using the incentive spirometer once I start feeling normal. D. Drinking fluids will help with my recovery. Answer: C. I can stop using the incentive spirometer once I start feeling normal. Rationale: this statement indicates a lack of understanding, as the incentive spirometer helps improve lung expansion and prevent atelectasis. Even if the patient feels better, they should continue using it to support full recovery and prevent complications. For a patient with pneumonia has a PaO2 of 52 millimeters of mercury on a 50% oxygen mask. What should the nurse do first? A. Increase oxygen to 60%. B. Notify the healthcare provider. C. Position the patient in high Fowler's position. D. Prepare for intubation. Answer: C. Position the patient in high Fowler's position. Rationale: placing the patient in high Fowler's position optimizes lung expansion, facilitating improved oxygenation. This is a priority action before considering further oxygen increase or other interventions. 5. The nurse assesses an elderly patient who is admitted with pneumonia. The patient has a new onset of confusion and restlessness. Which of the following should the nurse do first? Administer a sedative as ordered. B. Check the patient's blood pressure. C. Reassess the oxygen saturation level. D. Call the healthcare provider immediately. Answer: C. Reassess the oxygen saturation level. Rationale: confusion and restlessness in elderly patients with pneumonia can be signs of hypoxemia. Assessing oxygen saturation will help determine if low oxygen levels are causing the symptoms, which is a priority before taking other actions. 6. A patient with pneumonia is prescribed antibiotics, oxygen therapy, and hydration. Which lab finding would prompt the nurse to question increasing IV fluid intake? A. Elevated white blood cell count. B. Low hemoglobin level. C. Elevated BUN and creatinine. D. Low albumin level. Answer: C. Elevated BUN and creatinine. Rationale: high BUN and creatinine levels indicate potential renal impairment. Increasing IV fluid intake could worsen the patient's condition if they are unable to excrete fluids efficiently, so this should be questioned to avoid fluid overload. 7. When assessing a patient with pneumonia, the nurse notes the patient has a dry, hacking cough and is very lethargic. Which assessment findings should the nurse immediately report to the healthcare provider? A. Productive cough with green sputum. B. Respiratory rate of 22 breaths per minute. C. Persistent oxygen saturation of 89% on room air. D. increased temperature of 38.5 degrees Celsius 101.3 degrees Fahrenheit. Answer. C. Persistent oxygen saturation of 89% on room air. Rationale. An oxygen saturation of 89% is low and indicates hypoxemia, which requires immediate intervention, particularly in a patient with pneumonia. Low oxygen levels need to be addressed urgently to prevent further complications. 9. The nurse is reviewing discharge instructions with a patient who was hospitalized for pneumonia. Which of the following should the patient be advised to avoid? A. Hot showers. B. Dairy products. C. Smoking and secondhand smoke. D. Light exercise. Answer. C. Smoking and secondhand smoke. Rationale. Smoking and secondhand smoke can impair lung function and prolong recovery in pneumonia patients. Avoiding exposure to smoke is essential for healing and preventing future respiratory issues. 10. A patient with bacterial pneumonia has started antibiotic therapy. After 48 hours, the patient's symptoms worsen with increased dyspnea and pleuritic chest pain. What is the nurse's priority action? A. Check recent culture and sensitivity results. B. Increase the oxygen flow rate. C. Reassess for potential pleural effusion. D. Administer a bronchodilator. Answer. A. Check recent culture and sensitivity results. Rationale. If symptoms worsen, the causative organism may be resistant to the prescribed antibiotic. Reviewing the culture and sensitivity can guide appropriate antibiotic therapy adjustments for effective treatment. 11. A nurse is caring for a patient with pneumonia who has developed a sudden onset of chills, confusion, and a respiratory rate of 30 breaths per minute. Which of the following is the nurse's priority intervention? A. Obtain a chest X-ray. B. Start high-flow oxygen. C. Administer antipyretics. D. Initiate fluid bolus. Answer. B. Start high-flow oxygen. Rationale. The patient's respiratory rate and confusion suggest hypoxemia. High-flow oxygen is the priority intervention to increase oxygenation quickly. While antipyretics and fluids are essential, addressing the immediate oxygen needs takes precedence. 12. A patient is prescribed gentamicin for pneumonia. During the follow-up, the nurse notices the patient has decreased hearing and reports dizziness. What is the nurse's next step? A. Reassess lung sounds. B. Discontinue gentamicin immediately. C. Contact the healthcare provider. D. Decrease the dose of gentamicin. Answer. C. Contact the healthcare provider. Rationale. Gentamicin is ototoxic, and hearing changes or dizziness can indicate toxicity. The nurse should immediately inform the provider for further assessment and potential adjustments to avoid permanent damage. 13. A patient with pneumonia is prescribed both azithromycin and ceftriaxone. The patient asks why 2 antibiotics are necessary. Which response by the nurse is best? The 2 antibiotics work together to make sure all bacteria are killed. B. This prevents resistance from developing. C. Azithromycin targets bacteria in the lungs, while ceftriaxone targets blood infections. D. Different antibiotics cover different bacteria that could cause pneumonia. Answer. D. Different antibiotics cover different bacteria that could cause pneumonia. Rationale. Pneumonia can be caused by various organisms, and using a combination of antibiotics provides a broader spectrum of coverage to treat potential pathogens effectively. 14. A patient with pneumonia has been prescribed an albuterol nebulizer treatment. Which of the following findings would indicate to the nurse that the medication is effective? A. Decreased respiratory rate. B. Decreased wheezing. C. Reduced fever. D. Productive cough with yellow sputum. Answer. B. Decreased wheezing. Rationale. Albuterol is a bronchodilator, and its effectiveness is best determined by a reduction in wheezing as it opens up the airways. Other options do not directly reflect the action of albuterol. 15. A patient with pneumonia has been started on intravenous vancomycin. Which laboratory test is most important for the nurse to monitor during therapy? A. Complete blood count CBC. B. Blood urea nitrogen BUN, and creatinine. C. Liver function tests. D. Blood glucose levels. Answer. B. Blood urea nitrogen, BUN, and creatinine. Rationale. Vancomycin can cause nephrotoxicity, so monitoring kidney function through BUN and creatinine is essential. Detecting renal impairment early can help prevent toxicity and guide appropriate dosage adjustments. 16. While assessing a patient with pneumonia, the nurse notes the patient has a heart rate of 130 beats per minute and a blood pressure of 88/56 mm of mercury. Which of the following interventions should the nurse implement first? A. Notify the healthcare provider. B. Start a normal saline infusion. C. Position the patient flat with legs elevated. D. Check urine output. Answer. B. Start a normal saline infusion. Rationale. Tachycardia and hypotension suggest potential sepsis or dehydration. Initiating a fluid bolus can help stabilize blood pressure, improve circulation, and prevent shock. Further assessment and provider notification can follow. 17. A nurse is assessing a patient who has pneumonia and is complaining of severe right-sided chest pain that worsens with deep breathing. Which intervention should the nurse implement to alleviate the patient's discomfort? A. Encourage shallow breathing. B. Position the patient on the affected side. C. Offer the patient a bronchodilator. D. Apply a warm compress to the chest. Answer. B. Position the patient on the affected side. Rationale. Placing the patient on the affected side, splinting, helps reduce pleuritic pain and provides comfort. Shallow breathing can increase risk for atelectasis, and bronchodilators are unlikely to relieve pleuritic pain specifically. 18. A patient with pneumonia is found to have a blood pH of 7.30, PaCO2 of 48 mm of mercury, and HCO3 of 24 milliequivalent/L. What is the most likely acid-base imbalance? A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic acidosis. D. Metabolic alkalosis. Answer. B. Respiratory acidosis. Rationale. The low pH indicates acidosis, and the elevated PaCO2 suggests it is respiratory in origin, likely due to inadequate gas exchange from the pneumonia. 19. A patient with pneumonia has been instructed to drink 2 to 3 liters of fluid daily. What is the primary rationale behind this recommendation? A. Prevent dehydration due to fever. B. Enhance renal elimination of the antibiotics. C. Help liquefy respiratory secretions. D. Prevent secondary infections. Answer. C. Help liquefy respiratory secretions. Rationale. Increase fluid intake helps thin and mobilize respiratory secretions, making it easier for the patient to expectorate. This can improve breathing and aid in infection clearance. 20. A patient is recovering from pneumonia and has been advised to avoid strenuous activity. Which rationale best explains this recommendation? A. To prevent hypoglycemia. B. To conserve energy for immune function. C. To reduce oxygen demand on weakened lungs. D. To decrease production of respiratory secretions. Answer. C. To reduce oxygen demand on weakened lungs. Rationale. Limiting activity reduces the oxygen demand on the respiratory system, allowing the lungs time to recover from infection without additional strain. 21. A nurse is caring for a patient with pneumonia who is receiving supplemental oxygen via nasal cannula at 4 liters per minute. The patient reports a headache, dizziness, and has a respiratory rate of 8 breaths per minute. What should the nurse do first? A. Increase the oxygen flow rate. B. Decrease the oxygen flow rate. C. Assess the patient for signs of respiratory depression. D. Switch to a non-rebreather mask. Answer. C. Assess the patient for signs of respiratory depression. Rationale. A low respiratory rate with supplemental oxygen can indicate hypoventilation or respiratory depression, potentially due to oxygen toxicity or underlying respiratory compromise. Assessment should come first to determine if an intervention is necessary to prevent further hypoventilation. 22. A patient with a history of COPD is admitted with pneumonia and is receiving 40% oxygen via Venturi mask. The patient becomes increasingly drowsy with a respiratory rate of 10 breaths per minute. What is the most appropriate action by the nurse? A. Increase the oxygen to 50%. B. Call a rapid response team. C. Encourage the patient to take deep breaths. D. Reduce the oxygen concentration to 35%. Answer: D. Reduce the oxygen concentration to 35%. Rationale: patients with COPD may rely on hypoxic drive to stimulate breathing. High oxygen concentrations can reduce respiratory drive, leading to hypercapnia and hypoventilation. Lowering oxygen concentration can stimulate their breathing. 23. A nurse is evaluating a patient with bacterial pneumonia who has received antibiotics for 72 hours. The patient's temperature is 101 degrees Fahrenheit, and they report fatigue and a productive cough. What should the nurse do? A. Request a repeat chest X-ray. B. Reassure the patient that these symptoms are expected. C. Contact the healthcare provider for antibiotic change. D. Advise the patient to increase fluid intake. Answer: B. Reassure the patient that these symptoms are expected. Rationale: after 72 hours of antibiotic therapy, patients may still experience fever, fatigue, and cough. These symptoms often improve gradually. Reassuring the patient is appropriate unless symptoms worsen or additional complications arise. 24. A nurse receives orders to administer acetylcysteine to a patient with pneumonia. What is the primary purpose of this medication? A. To break down thick respiratory secretions. B. To reduce inflammation in the lungs. C. To relieve pleuritic chest pain. D. To improve oxygen saturation levels. Answer: to break down thick respiratory secretions. Rationale: acetylcysteine acts as a mucolytic agent, helping to thin and break down thick mucus, which is beneficial in patients with pneumonia to facilitate expectoration. 25. A patient with pneumonia is on 4 fluids and complains of shortness of breath. Upon assessment, the nurse notes bilateral crackles in the lungs and jugular vein distension. What should the nurse do next? A. Reduce the 4 fluid rate. B. Increase oxygen to 6 liters per minute. C. Obtain arterial blood gases, ABGs. D. Place the patient in a supine position. Answer: reduce the 4 fluid rate. Rationale: the symptoms suggest fluid overload, which can exacerbate respiratory distress. Reducing the 4 fluid rate helps prevent further fluid accumulation in the lungs, addressing the issue at its source. 26. Which dietary recommendation is most important for a patient recovering from pneumonia to support their immune function? A. Increase carbohydrate intake. B. Include more protein-rich foods. C. Avoid high-fiber foods. D. Limit fluid intake. Answer: B. Include more protein-rich foods. Rationale: protein is essential for immune function and tissue repair. Encouraging a diet high in protein supports recovery and helps the body fight infection more effectively. 27. A patient with pneumonia is on antibiotic therapy and develops oral thrush. What should the nurse suspect as the cause? A. Increased fluid intake. B. High dose of antibiotics. C. Inadequate oral hygiene. D. Poor nutritional status. Answer: B. High dose of antibiotics. Rationale: antibiotics can disrupt the natural balance of flora in the body, allowing opportunistic infections like oral thrush, a fungal infection, to develop. This is a common side effect of broad-spectrum antibiotics. 28. A patient with severe pneumonia is found to have low blood pressure, elevated heart rate, and decreased urine output. Which of the following interventions should the nurse prioritize? A. Administer 4 antibiotics. B. Begin 4 fluid resuscitation. C. Increase oxygen flow rate. D. Call for a stat chest X-ray. Answer: B. Begin 4 fluid resuscitation. Rationale: the symptoms suggest sepsis, a serious infection-related complication causing circulatory issues. Fluid resuscitation is the priority to stabilize blood pressure and support organ perfusion before additional interventions. 29. During assessment, a patient with pneumonia states, "I'm so tired, I don't even want to get up." Which nursing intervention is the most appropriate? A. Explain the importance of mobility in recovery. B. Schedule physical therapy for the patient. C. Allow the patient to rest uninterrupted. D. Restrict the patient's activities further. Answer. A. Explain the importance of mobility in recovery. Rationale. Mobility helps prevent complications like atelectasis and improve circulation. Educating the patient on its importance encourages participation in recovery while recognizing the need to balance rest and movement. 30. A patient with pneumonia has a blood pressure of 90/60 mmHg, a pulse of 110, and urine output of 20 milliliters per hour. Which condition is the patient likely experiencing, and what should the nurse prioritize? A. Dehydration. Administer 4 fluids. B. Sepsis. Call the healthcare provider immediately. C. Hypoxia. Increase oxygen administration. D. Heart failure. Administer diuretics. Answer. B. Sepsis. Call the healthcare provider immediately. Rationale. Low blood pressure, elevated heart rate, and reduced urine output indicate a high likelihood of sepsis, especially in a patient with pneumonia. Promptly notifying the healthcare provider is essential for early sepsis intervention. 31. A nurse is educating a patient with pneumonia about the use of a humidifier at home. What is the primary benefit of using a humidifier for this patient? A. It prevents the spread of bacteria. B. It decreases the need for antibiotics. C. It helps to moisten the airways and loosen secretions. D. It provides aerosolized medication. Answer. C. It helps to moisten the airways and loosen secretions. Rationale. Humidified air can ease breathing and promote the clearance of mucus in pneumonia patients, supporting a more comfortable recovery. 32. A patient with pneumonia and chronic heart failure is receiving 4 fluids. What findings should prompt the nurse to question the continuation of 4 fluids? A. Edema in the lower extremities. B. Blood pressure of 120/80 mmHg. C. Heart rate of 85 beats per minute. D. Respiratory rate of 16 breaths per minute. Answer. Edema in the lower extremities. Rationale. Edema in a patient with chronic heart failure receiving 4 fluids may indicate fluid overload, potentially worsening heart failure and respiratory status. The nurse should question continuing fluids. 33. A patient with a suspected aspiration pneumonia has a low-grade fever, cough, and foul-smelling sputum. Which diagnostic test should the nurse anticipate? A. Blood cultures. B. Bronchoscopy. C. Sputum culture. D. CT scan of the chest. Answer. C. Sputum culture. Rationale. Foul-smelling sputum and symptoms suggest aspiration pneumonia, commonly caused by anaerobic bacteria. A sputum culture can identify the causative organisms to guide appropriate antibiotic therapy. 34. When monitoring a patient receiving 4 antibiotics for pneumonia, the nurse notes redness and swelling at the 4 site. Which action is appropriate? A. Reposition the 4 catheter. B. Slow the infusion rate. C. Discontinue the 4 and restart in another location. D. Apply a cold compress to the site. Answer. C. Discontinue the 4 and restart in another location. Rationale. Redness and swelling suggest phlebitis or infiltration. Restarting the 4 in another location prevents further tissue damage and ensures effective medication delivery. 35. A patient with pneumonia has developed tachypnea, restlessness, and cyanosis. What is the nurse suspect, and what is the first action? A. Hypoxemia. Increase oxygen delivery. B. Hypercapnia. Notify the healthcare provider. C. Sepsis. Obtain blood cultures. D. Pleural effusion. Prepare for thoracentesis. Answer. Hypoxemia. Increase oxygen delivery. Rationale. Tachypnea, restlessness, and cyanosis are key indicators of hypoxemia, suggesting inadequate oxygenation. Increasing oxygen delivery is the first priority to address this respiratory compromise. 36. A nurse is caring for a patient with pneumonia who is on a 12-lead ECG monitor. The nurse notices the patient has developed a new onset of atrial fibrillation. What should the nurse do next? A. Check the patient's vital signs and oxygen saturation. B. Administer prescribed antiarrhythmic medications. C. Increase oxygen delivery. D. Notify the healthcare provider immediately. Answer. I check the patient's vital signs and oxygen saturation. Rationale: new onset atrial fibrillation can be triggered by hypoxia or infection in pneumonia patients. Checking vital signs and oxygenation helps assess stability before deciding if further interventions or notifying the provider is necessary. 37. A patient recovering from pneumonia has a low energy level and decreased appetite. Which intervention would be most appropriate for the nurse to implement? A. Encourage small, frequent high-protein meals. B. Withhold meals until the patient is more energetic. C. Encourage high-calorie drinks only. D. Administer appetite stimulants as prescribed. Answer. Encourage small, frequent, high-protein meals. Rationale: small, frequent, high-protein meals provide essential nutrients and energy in a manageable format, supporting recovery without overwhelming the patient's reduced appetite. 38. A patient with pneumonia has a pleural effusion confirmed by imaging. The healthcare provider orders a thoracentesis. Which action is essential for the nurse to perform during the procedure? A. Position the patient supine with head elevated. B. Monitor for hypotension and tachycardia. C. Encourage the patient to cough frequently. D. Hold the patient's arms at their side. Answer. B. Monitor for hypotension and tachycardia. Rationale: thoracentesis can lead to complications such as hypotension or hypovolemia. The nurse should closely monitor vital signs during the procedure to detect adverse reactions. 39. A patient receiving antibiotics for pneumonia develops diarrhea. What is the nurse's most appropriate intervention? A. Hold the antibiotic and notify the healthcare provider. B. Encourage increased fluid intake and monitor stools. C. Administer antidiarrheal medication as needed. D. Perform a stool culture immediately. Answer. B. Encourage increased fluid intake and monitor stools. Rationale: antibiotic-associated diarrhea is common, but it should be monitored to differentiate from more severe conditions like C. difficile. Increasing fluids prevents dehydration while tracking symptoms. 40. A patient with pneumonia is advised to use an incentive spirometer. What statement by the patient indicates correct understanding of the device's use? I should breathe out forcefully into the device. B. I'll use it only when I feel short of breath. C. I'll use it every hour to help clear my lungs. D. I'll hold my breath for 2 seconds after exhaling. Answer. C. I'll use it every hour to help clear my lungs. Rationale: frequent use of the incentive spirometer promotes lung expansion, helps prevent atelectasis, and facilitates the clearing of respiratory secretions in pneumonia patients. 41. A nurse notes that a pneumonia patient has developed confusion and agitation. What is the most likely cause of these symptoms? A. Elevated carbon dioxide levels. B. Increased WBC count. C. High fever. D. Dehydration. Answer. Elevated carbon dioxide levels. Rationale: confusion and agitation are often early signs of hypercapnia due to respiratory failure. This requires immediate assessment and possible intervention. 42. For a patient diagnosed with pneumonia, which factor increases the risk for delayed recovery? A. Age of 25 years. B. BMI of 20. C. History of smoking. D. Recent travel abroad. Answer. C. History of smoking. Rationale: smoking damages lung tissue and impairs mucociliary clearance, which can delay recovery from pneumonia by affecting respiratory function and lung healing. 43. A nurse is monitoring a patient receiving high-dose steroids for pneumonia. Which adverse effect should the nurse monitor for? A. Hypokalemia. B. Hypercalcemia. C. Hyperglycemia. D. Hypotension. Answer. C. Hyperglycemia. Rationale. Steroids can cause hyperglycemia, especially at high doses, as they promote glucose production in the liver. Blood glucose levels should be monitored regularly. 44. A patient with pneumonia is taking codeine for pain management. What is the primary concern the nurse should monitor for in this patient? A. Hypertension. B. Constipation. C. Increased respiratory rate. D. Drowsiness. Answer. B. Constipation. Rationale. Codeine, an opioid, commonly causes constipation, which can worsen respiratory issues by limiting effective coughing and secretion clearance. Drowsiness is also a concern, but is less directly related to respiratory function. 45. Which lab finding would be most concerning in a patient with bacterial pneumonia receiving IV antibiotics? Elevated liver enzymes. B. WBC count of 9,000/mm superscript 3. C. Hemoglobin level of 15G/DL. D. Decreased creatinine clearance. Answer. D. Decreased creatinine clearance. Rationale. Antibiotics are often renally excreted, so decreased creatinine clearance could indicate impaired renal function, increasing the risk for antibiotic toxicity. 46. A patient with pneumonia reports fatigue and persistent shortness of breath. Which follow-up test might the nurse anticipate the healthcare provider ordering? A. Complete blood count (CBC). B. Sputum culture. C. Pulmonary function test. D. Electrocardiogram (ECG). Answer. C. Pulmonary function test. Rationale. Pulmonary function testing can evaluate lung capacity and function, especially if symptoms persist, suggesting long-term respiratory effects of pneumonia. 47. A nurse is assessing a pneumonia patient's ABG results. pH 7.47, PaCO2 33 mm of mercury, HCO 3, 24 milliequivalent/L. How should the nurse interpret these findings? A. Respiratory alkalosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Metabolic acidosis. Answer. Respiratory alkalosis. Rationale. The pH is elevated and PaCO2 is low, indicating respiratory alkalosis. This is commonly due to hyperventilation, possibly secondary to hypoxia in pneumonia patients. 48. A patient with pneumonia who is receiving antibiotic therapy has a high-pitched whooshing sound heard over the heart with each beat. The nurse suspects which complication? A. Heart murmur due to infection spread. B. Normal finding. C. Pleural rub. D. Pulmonary embolism. Answer. Heart murmur due to infection spread. Rationale. Infectious endocarditis can occur as a complication if bacteria spread from the lungs to the heart, causing new-onset murmurs. This warrants further investigation. 49. Which electrolyte imbalance is most likely to occur in a patient with pneumonia who is experiencing frequent vomiting? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypernatremia. Answer. B. Hypokalemia. Rationale. Vomiting leads to loss of gastric potassium, often resulting in hypokalemia. This imbalance can exacerbate respiratory and muscle weakness. 50. A patient with pneumonia presents with pleuritic chest pain and is on bed rest. Which complication is this patient at highest risk for? A. Atelectasis. B. Pulmonary embolism. C. Pleural effusion. D. Pneumothorax. Answer. B. Pulmonary embolism. Rationale. Prolonged bed rest increases the risk of deep vein thrombosis and, subsequently, pulmonary embolism, especially if accompanied by pleuritic chest pain.